Okay, I just want to say hello to my freshman students, and I also want to let you all know that I miss you very, very much. Wish you were here, but maybe we'll get this coronavirus thing passed, and maybe we can get back together, hopefully in the fall or something like that. But anyway, so here is, I believe, our last skill, and we'll do a quiz over this one. So I'm just going to demonstrate how to change the colostomy appliance. I think a lot of you have already done this. Anyway, just going to show you right quick. It's not very hard. Just a few points that I want to talk to you about before we begin. So never refer to the appliance. This is the appliance. Let me show you even better. That's the appliance. Don't call that a bag. All right, we just try to stay away and avoid that word when we can. However, during this video, I may refer to it as a bag so that I make sure you understand I'm talking about this, but don't refer to it, don't document bag, don't refer to it as a bag in front of your client. Say colostomy appliance, the appliance, or whatever. So just want you to be aware of that. Okay, second thing, we're talking about colostomy. That is in the large bowel. Usually, the large bowel. So you have the ascending, the transverse, and the descending. And so it is more formed type stool usually. And then the ileostomy, and ileostomy is more in the small bowel section. And it is more fluidity or fluid. They call it actually effluent. Effluent is the name of it. And the effluent is full of digestive enzymes and bile salts. And so those are digestive enzymes. And so if you get those on the patient's skin, it will literally just digest their skin. It will eat their skin raw. And so you've got to be very careful when you're dealing with an ileostomy with that effluent. And I want you to remember that and know that. Now, colostomy, as I said, in the large bowel is where your water starts becoming absorbed in that area. So by the time it gets over here and down here, it is formed stool. Soft formed stool is what we expect. And so you just want to, be careful with that. But, if they have, so there's usually not a problem there with it bothering the skin, digesting the skin, or something like that. However, unless there is fluid coming out with that. So if they have diarrhea, or they got some fluid coming out with that, then if that gets on the skin, obviously, just like a baby, diaper rash, right? Just like a baby would get, this person would get too. But just remember that effluent is with the ileostomy, and it has digestive enzymes and bile salts that will really eat your skin off. So got to be very careful with that. So what we're going to do is we're just going to change the colostomy appliance. I'm going to do a two pouch system. And what that is you can reuse. It comes with two pouches, or they can buy more. And you can just interchange those out and leave the faceplate on the patient's skin for several days without having to change that. Now, what the advantage is over the single pouch system is that you have to take that single pouch system off a lot more, and so you have a greater chance of excoriating the patient's skin. It's just like putting a tape over the patient and ripping that tape back off the skin, and doing that more frequently. So the the double pouch system works better, and we can leave it on longer so you get less excoriation of the skin. So it's a better system. However, though, I will get started with this. So, I'm going to talk about the appliance first. Is the appliance, assess your patient. This would be a great time to assess the abdomen, to listen to bowel sounds, to check if there's any tenderness to the abdomen or anything like that. And then assess your appliance here for how full is it at this point in time. If it is over half to 3/4 full, and the effluent, if there's effluent in there or diarrhea, it's kind of runny appearance to me, then I'm probably going to go ahead and take this off. Have a bedpan there, and just take this off and let that run into the bedpan. If you don't, what is likely to happen is that it will slosh or spill and get on your patient and stuff like that. and we don't want a big mess there. Hold on to this. These are at a premium. They're like gold. You only get like 1 or 2 with a system, and man, I'm telling you, these are just priceless. So make sure you hold on to that. Good. Clean it off if it needs it, and then go from there. Now, if my effluent is less than half a bag full, or the stool is formed, it's a colostomy and it's formed, then I'm probably not going to do this part yet. You could just go ahead and take the bag off. But if it is over half to 3/4, you probably want to drain it. And then, because what you're going to have to do is you're going to have to take this appliance off. I can grab a tab there and peel it off of what we call the skin barrier or the face plate. Now I'm going to actually just hold this up. It's not actually on my mannequin here, but this is the skin barrier or face plate. And what you can see is, I'm just going to bring this over here so you can see it better, is it's like a Tupperware bowl. So this is like a Tupperware ring. And then this has the ring around it also, and they just connect up, and it's just like putting a Tupperware lid on. And so that's actually what you have there. So I'm actually going to take this appliance off once I get that off, and I'm just going to lay it down in the bedpan, and either most of the time what I do, if the scent is not too strong and I don't think it's going to bother the patient, it doesn't bother me because I'm used to it. But if I feel like it's not bad, it's not going to bother the patient, I usually just slide it under the bed and carry on with my work, because my patient wants to get this done. They want to hurry up. They want to get this over with. Okay, but if it's strong, I will go ahead and just take it over to the restroom. But before I leave, I will take a little 4x4, and I will just lay that 4x4 over there to catch any seepage. So I'll just take this off over there, and we're back. Okay, so the next thing I'm going to do then, and we'll get rid of that, and I'm going to take this off, okay, and just start peeling this off, applying counter traction. Now that's important, I want you to know that. Applying counter traction. So what I'm doing is I'm kind of pulling up on the face plate and pushing down with my thumb on the patient's skin, and just kind of doing that and working that over. So I'm going to work that, okay, all the way around there, and just keep working that and working that and working that down, applying that counter traction all the way until I get the face plate removed. Now, again, put that in your biohazard bag. All right. So then the next thing that I want to do is just clean this off good. Now, I still, some are changing. They're saying that you don't have to use soap in the water, just use a damp cloth and stuff. I'm still old school guy, so I still want to use some soap and water. Mild soap, though, and just clean the stoma really good. Now, it's not going to hurt you to touch the stoma, to wash the stoma off well. So we're going to wash it off, okay, and wash the skin around it about, as big, a little bit bigger than what your face plate is going to be back on. And so I want to clean all that. I want to get all that skin nice and clean. Okay, so with a little soap, and I'm going to rinse, okay, and pat that off there, get that soap off. Now, I do want to make very certain that I rinse it really well. I want to get that rinsed really good, get all that soap off there, because I don't want to leave any residue on there, which could also irritate the skin. So I want to make sure that I rinse that off really good. And then I'm just going to pat it dry, because I have to put my sticky face plate back on there. All right. So once I have done that, now I've got everything clean, and I can assess my stoma and the peristomal skin. Peristomal skin just means the skin around the stoma. I expect this stoma to look a pretty beefy red kind of color. If it's immediately or shortly after their surgery, it's brand new, I expect to see a little oozing of blood, but by the next day or day after, no more bleeding. If it's turning bluish discolor, pale discolor, I'm going to be concerned about it not getting enough blood flow, and I will notify the healthcare provider. If it's starting to turn black, not getting enough blood flow, notify the healthcare provider. All right, but outside of that, I think everything is looking good. The peristomal skin looks good. I don't see any excoriations around there or anything like that. So as I work with the rest of my equipment here, I just like to take that second 4x4 that comes in my pack and just lay it over there to catch any, oozing that might occur or anything like that. Okay, so then what I'm going to work with is my measuring device that comes with your stoma kit. And so this is your device. So what we got to do is we got to measure the exact size of the stoma, okay, so that we can cut that hole out on the faceplate. And so I would just start, okay, move this over, and just go, okay, that's too small, that's too big, aha, that's just right. So perhaps on my patient, this patient, because they're all going to be different, especially if it's a brand new one. If this is a surgical patient, come back and you're changing the appliance for the first time, it's going to be swollen, and I expect to see shrinkage as the days progress. We expect it to get smaller and smaller. But every patient is going to be different. Every surgery is going to be different. So that's why we measure. Now, so I'm going to say this is what I've got my measurement here. So I'm going to get my brand new faceplate out, and I'm going to lay that right over the center hole there. So here's my size there. And so I'm going to center that up as best I can right over the little hole that's already provided there. And I'm going to take an ink pen and draw the circle around that so that I get that pattern right around there. So I'm going to take an ink pen and draw that around. And then I'm going to take my scissors and I'm going to put my scissors in here and I'm going to cut out that hole around through there, okay? And I want to make it about an 1/8 inch larger. Now that's important. I want you to know that. 1/8 inch larger, okay? So that's what I want to cut that out. The reason we do that is because I want it to go over my stoma snugly, but not touching it, not to where it might seesaw back and forth and move with the patient and kind of rub the stoma. So I'm going to cut it 1/8 inch larger, and that should fit with just a little bit of room around the stoma there. All right, so now, once I've got that ready to go, then I'm going to look at that peristomal skin really good, and I'm going to see if there's any creases, any dimples, any wrinkles, anything that might allow a watery stool, effluent, anything runny like that to get under the faceplate. If anything gets under the faceplate, it's going to excoriate that skin. It's going to eat that skin off no matter what it is, no matter what type it is, no matter what, it's going to excoriate that skin. So what we'll do is we want to make a flat surface. Now, if I don't need this, I'm not going to use it. If I'm looking and I assess my patient, go, okay, her skin there, everything there is flat. There's no dimples, no creases, no wrinkles, nothing there, then I'm good to go with that. But if there is, I'm going to use, this particular preparation is called Caraya paste. Okay, so that's just one manufacturer's name. All right, and so what I'm going to do though is any dimples or creases that will be under my faceplate there is I'm just going to take that off and I'm just going to fill in, okay, just like, just filling it in and make that a nice smooth surface under there. So I'm going to put that back on. All right, and then here we go. So what actually we do here is this backing. The white backing here comes off, okay, and I'm not going to actually take all this off, but it's sticky. You can feel that, and it's very, very sticky, so that will stick onto my patient's skin very well, and it will stick on the Caraya paste very well. All right, so we've already cut our hole out, and we've got it, so I'm just going to bring it up here, and I'm going to center that right up over the stoma, and just ease that down on over the stoma. Okay, and once I do that, I'm going to start from where the stoma is at the center of the pad, and I'm going to just keep walking my thumbs out and just keep walking out and walking out. And what I'm trying to do is just move all the air bubbles out all the way from the center outward is what I want to do, just try to move all air bubbles. And I want to get that as smooth and as flat as I can in there. So once I've got that done, and that's stuck on there good, all right, I'm going to take my ostomy appliance here and just like I said, a Tupperware bowl, and we're just going to place that on there and push that down, just like putting a lid on your Tupperware bowl. Okay, you can hear it snapping on. Okay, and there we go. Okay, Now, the next thing I want to do is get my little device that closes it back off so that my patient can get up. And one more thing that I will tell you, just reminded me when I said when my patient gets up, if this patient is bed fast or on prolonged bed rest and they're not allowed to get up or not going to be able to get up, then I always do my appliance this way. It just makes it easier on the patient. It makes it easier on you to change it, to empty it, to do all these things, because if they can't get up, it's always going to be bedpan usage there. So this way works really good. Now, if my patient is active though, and they are going to be getting up, then I go ahead and put it down that way because that makes more sense. It's up and down with the leg that way. And so that makes more sense. All right. So, however, though, I have my appliance there. Now I'm going to take this and just put the plastic appliance through there and close that. And I always make sure that this locks in place right there. I always check that and make sure it locks in place good. And so you have done a colostomy appliance change, and the patient can now, if they're able to get up, they can go get up, or if not, they can just do any activities that they need to do in their bed. And I hope that is helpful to you. And as I said, I will send you a handout on this and a little quiz shortly. So be looking for those. All right. Thank you, guys.